When we heard that Senator McConnell was summoning us back to Washington, D.C. after 5 or 6 weeks where we were, most of us, sheltered in place at home, I was waiting to hear the agenda. I knew what America was focused on, a national emergency, in the words of President Trump, a public health care crisis that we hear about every minute of every day that has literally changed the lives of so many people across America, and as of this moment claimed at least 70,000 American lives. 1.2 million people infected, at least based on testing so far. It is the gravest challenge and crisis that we have faced, many of us, in our lifetime. And so I thought if the Senate Judiciary Committee is coming back for business, there's certainly a lot of things we can bring up related to this COVID-19 crisis. We could certainly be asking the Subcommittee on Border Security and Immigration to address the issue of over 50,000 DACA and TPS classified critical health workers in America whose status under the immigration laws of our country are at least uncertain. We could be bringing that up and discussing whether or not we can afford to lose 50,000 healthcare professionals at this moment in our history. The Subcommittee on the Constitution could have asked us to take a look at how the election is going to be held in November, whether Americans are going to have an opportunity to vote, even if they're fearful of leaving their homes and going to a polling place. The Subcommittee on Crime and Terrorism could have certainly asked us whether we have sufficient protective equipment for police and first responders, and whether we're doing all we can to protect federal prison guards. Take a look at the numbers, if you haven't seen them, in the Bureau of Prisons, not just of the incarcerated who are infected, but also the guards who are being infected as well. We could have, of course, asked the Subcommittee on Oversight to take a look at Senator McConnell's own suggestion that we address the issues of liability across the board in terms of COVID-19. Certainly a worthy topic, and one that we may, I understand, bring up next week. AARP tells us seniors across America are facing health care scams at a record number because of this COVID-19 crisis. This is within the jurisdiction of the Senate Judiciary Committee. The list is lengthy, and unfortunately, it isn't the reason we're returning this week. Instead, we're considering the nomination of a 37-year-old family friend of Senator McConnell's to the second highest court in the land, a nominee who has a record, ironically, of stridently opposing the Affordable Care Act, which seeks to extend health insurance coverage to more Americans, and who was last year found unqualified to serve as a district court judge in the Commonwealth of Kentucky. But now, after his 6-month career on the Kentucky District Court, he's obviously, in the eyes of Senator McConnell, worthy of a promotion to the second highest court in the land. This is the second time that Senator McConnell has prioritized this judge over the coronavirus. The first was when he recessed the Senate in March to attend the ceremonial investiture. Senator McConnell said last week that when it comes to COVID-19 pandemic, quote, "We cannot get distracted by pre-existing partisan wish list," end of quote. That is exactly what is happening in this hearing. We're in the middle of one of the greatest public health crises in the history of our nation. We're sitting in a committee with jurisdiction in so many critical areas when it comes to this crisis, and instead, Senator McConnell is unwilling to set aside his wish list to filling the courts. The American people deserve better.